Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in this video today, I'm going to be discussing a topic that I keep getting asked and then I keep saying it discussed and asked in forums. So it's in regards to the question of what classes helped you in what prerequisite classes or just classes in general from your undergrad helped you in PA school. So I wanted to discuss this because I feel like this is asked a lot. And, it's controversial, of course, it depends on the individual. But in my experience, I have to say that the classes that benefited me the most was definitely, I took Parasitology as one of my classes for my undergrad. It was an elective for my biology degree because I majored in biology, Bachelor of Science biology as my degree for undergrad. And so I had electives, and one of the electives I chose was Parasitology. I loved that class so much. I just love infectious diseases in general, and right now, since I have all this free time, since I'm kind of waiting to move to Pennsylvania because I'm from the state of Texas, I'm moving to Pennsylvania and I'm waiting to move there, and I've started applying for jobs and etc. Since I have all this free time, I've been reading a lot on infectious diseases because that was one of my favorite topics in PA school also. And unfortunately, I didn't do a rotation in that, but I really recommend it for those of you who want to do infectious diseases. I had some classmates that did it and they loved it. But regardless, I really loved Parasitology, that class, and I felt like that class helped me a lot in PA school, specifically for your infectious disease portion, which is going to be on your pants also. It really helped me with the parasites. Of course, in comparison to my Parasitology class at PA school, you don't go into depth as learning the cycle of the parasites, it goes into this eggs and turns into this and merozoite, etc., blah blah blah. And you really don't learn as much for that portion, but you do learn on how does the patient present, how you can treat it, what is it called, how is it caused, etc. This class really helped me in PA school in regards to my infectious diseases, and I think that's one of the reasons why ID has always been really high for me. Was really high on my pants also, and just in all my exams it's been really high, and I think that's one of the reasons why was because of that class, that Parasitology class. And especially if you're passionate about something, right, of course you focus all your time on it, but Parasitology really helped me for PA school. So I recommend for those of you who are interested in just infectious diseases or want to do even family medicine, do something like Parasitology. You learn about your pinworms, you learn about malaria. For those of you that want to do tropical medicine, which is what I want to do, want to go overseas and practice and do some volunteer work, which is what I want to do, I really recommend you a class like Parasitology if your program offers it. And another class I recommend is Virology. Unfortunately, I did not do that. I wish I would have taken that class. Instead I took animal physiology, which was a good class, but I should have taken Virology. Virology, from some of my classmates that took it, has been very helpful because, once again, that's part of your infectious diseases. A lot of your viruses that we see, COVID-19 right now, right? Most of the viruses that we see that cause disease in humans is what you learn in PA school, from pulmonology to OB-GYN. So you have, for example, your viruses like your RSV virus, right, in children that causes bronchiolitis. You have influenza, the COVID-19. You think about OB-GYN, human papillomavirus that causes cervical cancer. So if you have a basis of understanding of just how viruses work, and then those important viruses that I teach in virology, I really recommend that class. And I listen to podcasts in regards to virology. This Week in Virology is a good podcast, and that's how I know a little bit about viruses, and also I read a lot of books on infectious diseases. But if you can, I really recommend virology. Another class that is usually a must and a prerequisite is your microbiology. Microbiology is so important, guys, really important. It teaches you the foundation on bacteria, gram-negatives, gram-positive. And not only that, it helps you understand how to treat them. That's one of the things that I think as students, we struggle a lot, and I have to say that I struggle a lot, is just treating your bacterial infections, What are your antibiotics? Which ones cover gram-negatives, gram-positives? Which ones are used for anaerobes? Which ones are used for aerobes? Like macrolides, what do you use macrolides for? Penicillin, what is it good for? What type of bacteria? Another way, how I've seen these questions asked on your exams that you're going to have in PA school in your pants is they'll describe the bacterium for you, gram-positive diplococci, gram-negative. etc., intracellular gram-negative bacteria. And you learn all this terminology in microbiology. In PA school, you enter kind of already with the fact that you already know that information. So microbiology was definitely one of the huge classes that helped me in PA school. So of course, most of the programs that I know of require microbiology as a prerequisite. But when you're completing this class in your undergrad, don't just take it for advantage. Make sure that you actually pay attention and that you learn the information, because it's going to help you out in PA school. Another one for sure, of course, is going to be your anatomy and physiology courses. Those are huge. Unfortunately, and I probably said this in my previous videos if you've seen them, I took my anatomy and physiology my first year of undergrad. And the second part, I took it, so it's AMP 1 and 2. One was that fall of 2010. Okay, and then 2011, I took it, the summer of 2011, I took my anatomy and physiology 2. Now, mind you, I applied to PA school in 2017. I got accepted into 2018. That was almost like 6 or 7 years since I had touched anatomy. So of course, like when I started anatomy, it was just like I remembered a few things here and there, but I didn't remember everything. So I was having to relearn everything all over again. So I recommend for these classes, if you can, to take them possibly in your junior or senior year when they're fresher in your mind, because some of my classmates that had just graduated from their undergrad like a semester ago, they were like doing so well in their anatomy and physiology because they had just remembered it. So definitely recommend you to take those classes, and the ones I've discussed like Parasitology, Virology in your junior or senior year, Microbiology also. That way when you start PA school, it's fresh in your mind. And these classes are really important for you to understand medicine also. So really recommend that. Another thing for those of you who are watching this video and are in high school and are interested in applying to PA school, I really recommend Pharmacology. My high school offered Pharmacology, and I really liked the class because, and I still have notes from it too, because it kind of just taught you a base, like just a base or a foundation for pharmacology. This can definitely help you in PA school, and of course in high school they also offer anatomy, physiology, and then your chemistry AP classes. So I really recommend, if you can, to do those classes for sure. So that's in high school. And another course, Biology 1 and 2 for sure, because once again this is like your foundation, right, of biology, because once you start PA school, it's kind of with the understanding that you'll already know these foundations. I do have to say though that chemistry was my least favorite. Biochem 1 and 2 and just Gen Chem 1 and 2. I didn't really use this in PA school. Some of you can possibly, PA students that are in PA school right now, could possibly disagree with me, but I mean, I've already graduated. I did though get pimped on it during my clinical rotations for Biochem. I got pimped on the lactic acid pathway. And so for Biochem, I feel like Biochem was important, especially learning like, lactic acid pathway, glycolysis, etc., because it helps you understand further why you order lactic acids for patients. Why do patients just go in lactic acidosis, etc. So I think that class was also vital, very vital, but Biochem 1 and 2, Gen Chem 1 and 2, not really. Possibly for your pharmacology, but it was very, very little. But definitely the ones that I've mentioned, like your Biology 1 and 2, your Anatomy Physiology 1 and 2. If you can take some of your electives like Virology, Parasitology, I really recommend it. Microbiology. I know my university even offered classes like Bacteriology. I wish I would have taken Bacteriology. Unfortunately, I didn't. Another class that I took was Genetics. If you can, Genetics is also very helpful. I had a question on my practice pants the other day on genetics, and I was so mad because I missed it. And I was like, oh my gosh, I haven't seen genetics in a while. And I think genetics is such an important class because, and I think genetics, if not, is a prerequisite for most of your PA programs, but it helps you understand why certain diseases are autosomal recessive. How are they transferred to their offspring? Autosomal dominant, if it's autosomal dominant, like what is the percentage that the child's going to have it? If it's autosomal recessive, what's the percentage that the child's going to get this, etc. So it's really, really important. So I really recommend genetics, especially when it comes down to understanding like your Down syndrome, right? Like your trisomy 21. Edwards syndrome, Alport, all the other ones that are genetically, how are sickle cell, for example, right? Which ones are excellent, your hemophilias, A and B. So I really recommend, if you can, to take a class in genetics. So we said genetics, virology, bacteriology, microbiology, definitely, anatomy and physiology for sure, parasitology if your program offers it, your school offers it, I really recommend it. For those of you in high school, anatomy and physiology 1 and 2. Also, if you can take pharmacology, if your high school offers it, I really recommend that also. So yeah, just in general, those are the classes that have really helped me out in PA school. And yes, you know, they do help you out. I've had questions on whether do these classes really help me out. Yes, they do. In regards to your other ones, like I said, Chem, Gen Chem, not really. Biochem, if anything, would be the one that will definitely help you. Statistics is a huge one also. It's really important to make sure that you know your statistics, because anyone that's in medicine, even as a medical provider, you know, medicine is changing. And especially right now during the COVID-19 era, I mean, we're learning so much about COVID-19 that, and thankfully, like, the whole world is contributing to that. So you're seeing all these papers getting posted and research articles getting posted. And to go through those research articles and to read all the information and to dissect the information, specifically the statistics information, is really important. So classes like your statistics classes, it's going to be really helpful in that. So I really recommend statistics. I actually had a class during my didactic year in regards to how to understand this. So I really recommend statistics. Make sure that you do really well, even though you're like, that's math. Yeah, but it's important because you're going to use it to understand other information. But yeah, that is just my point of view. Hopefully this video is helpful for you guys. If you have any questions or any topics you guys would like to discuss, feel free to comment below, and I'll talk to you guys later. Bye.